Hi, my name is Mimi Tran, Community Advisory Board member of the Office of Community Outreach, Engagement, and Equity, otherwise known as the COEE. And you're watching Let's Talk About It. I am a breast cancer survivor. I was triple negative during the time that it was 2019 when I founded Me Square Cancer Foundation. Me Square Cancer Foundation helps newly diagnosed adult cancer patients, all kinds of cancer in the DFW area, by helping them through their financial and emotional journey. How we do that is to grant these patients money to be able to pay for their deductible so that they can get their treatment. Joining me today is Dr. Sandi Pruitt, Associate Director for the COEE at UT Southwestern Simmons Comprehensive Cancer Center.
Thanks so much for having me. It's a pleasure to be here. And Mimi, thank you so much for all that you do for our community members with cancer. Hi, everyone. I'm an associate professor here at UT Southwestern, and also, as Mimi said, associate director of the COEE office. I do research related to cancer equity and health outcomes and the social determinants of health, and I also help lead the functions of the COEE office.
Thank you so much. In honor of February National Cancer Prevention Month, Dr. Pruitt and I will be touching on some ways that the Simmons COEE is working towards cancer prevention and equity for the DFW community. To start off, what is Simmons COEE doing to help lower cancer's impact on DFW communities?
Right. The Office of COEE's mission is to reduce the cancer burden in North Texas and beyond, and to promote equity in cancer prevention, care, and outcomes through research, through education, engagement, with a particular focus on health equity and getting the word out to our very diverse population.
Okay,
we do a lot of things related to this topic, and we're growing. We have 4 aims in general. We try to measure the cancer burden in our region, which is the DFW metropolitan area of 13 counties. We try to foster new research that's relevant to our community here in North Texas, using engagement principles with our community. We work to implement outreach programs guided by community input and aligned with the best, most current evidence, and we work to monitor the impact of our work.
How is the COEE addressing key challenges such as equity in access to cancer care?
Thanks so much for this question. It's a really big challenge. We're working in several fronts and working with several strategies to help deal with equity. First and most importantly, we work to talk about it. A lot of times there's a lot of information about cancer equity that not everyone is aware of. Some of us have more access to cancer care than others. So merely getting the word out to the community is really important, and we work to do that in a lot of ways. But we're also working to work with our CAB members and our other community members, such as yourself, to really stimulate and motivate engagement and action to help drive program changes, to promote policies and programs that help eliminate inequities, and to simply change the landscape, because everyone deserves access to cancer prevention and control technologies and methods, but currently not everyone has that.
How about the community's access to information and knowledge about cancer?
Well, as you know, Mimi, there's cancer is complex. It is a combination of many different types of diseases, and is always changing what we know based on our discoveries, including a lot of discoveries that we generate here at Simmons Cancer Center. So a key component of what we do is getting information out there, and we have a lot of different ways to do that. One is through social media. The other is through monthly newsletters that we generate. And we also work to build community capacity to help share that information among people who lead nonprofits and general community members to make sure that that information is out there, because there's so much misinformation. There's a lot of stigma that comes along with that misinformation as well. And we see that as a core component of our mission.
What about what the COEE is doing to address cancer prevention and risk reduction? And what are some ways community members can access screening services for cancer prevention and early detection?
Yeah, this is a really important one because if you've been following the news, you'll realize that recommendations for cancer screening, for example, change over time
Mhm.
as our risks in our population change and as we learn more and hone our screening guidelines. So one of the key things we do is get information out there through our newsletter. Our monthly newsletter will often include links to ongoing screening programs or resources for programs that help people afford or access screening. So we see that as a tool to really connect people to the resources that are already out there in the community without us having to recreate the wheel.
Finally, how can community members join COEE in cancer outreach, education, and achieving equity?
Yeah, well, there's so many ways that people can get involved. And over the coming year, we're working on building out more ways for the community to get involved. Feel free to reach out to our office anytime, and we're happy to direct you to some of our activities where you can get involved or the activities of other participating community groups. Simple ways to get involved is to sign up for our monthly newsletter. Because that we often provide action items in each newsletter, something that you can do to get involved, whether that's something about your own individual health behavior or a health behavior you can help recommend to your friends, families, neighborhood neighbors, for example, such as getting exercise and eating and getting our screenings. But we also recommend and provide suggestions in the newsletter for other ways to get involved. We also would love for people to consider applying to join our next cohort of research advocates. Then the upcoming program will start again in 2023, the spring. And we would love you to participate in that program to really build skills in how to become a good research advocate. In turn, that helps improve the research we do here at Simmons to make sure it's more relevant for community members. So that's a really valuable way to get involved. Another option is to invite our Speakers Bureau to visit your organization. We can provide educational programming about cancer prevention and control treatment. We love to come out to organizations either virtually or in person to provide that information. And we're also working on future volunteer programs as well, so we can get the community more broadly involved in our efforts at health fairs and through other avenues to help spread the word.
Looks like a lot of ways that we can help as community members.
Yeah, as you know, Mimi, there is so much we need to do, and we can't do it individually. We have to work together. Thank you so much for watching this episode of Let's Talk About It, where we discussed a few of the things the Simmons Office of Community Outreach, Engagement, and Equity is doing to better equitably serve our community with cancer prevention, detection, and education services. And thank you so much, Mimi, for being part of our Community Advisory Board and all that you do for our community members with cancer.
Absolutely. Absolutely.